Hi everyone, I'm Scott Podolsky, and our Department of Global Health and Social Medicine is thrilled this semester to again co-host with the Harvard University Native American Program multiple seminars devoted to the health of Indigenous peoples. For this, we're grateful for the wisdom and leadership of my colleague, Joe Gahn. I'll get to introduce Professor Gahn himself, and he'll have the honor of introducing today's speaker, Dr. David Wilson. Joseph Gahn is Professor of Global Health and Social Medicine in our department and Professor of Anthropology in the Faculty of Arts and Sciences in Cambridge. He's collaborated for over 25 years with American Indian and other indigenous communities to rethink community-based mental health services and to harness traditional culture and spirituality for advancing indigenous well-being. He's an enrolled member of the Honorary Tribal Nation of Montana, and among many other roles, is the director of the Harvard University Native American Program and an elected member of the National Academy of Medicine. So with that, I will hand this over to Dr. Gahn.
Thank you, Scott. Such a warm welcome, and I appreciate, as always, your willingness to host us for this seminar series. This is the Indigenous Health and Wellbeing Colloquium series, which I'm so pleased to say was proposed in my role as faculty director of the Harvard University Native American Program, and then enthusiastically taken up and taken on by my Department of Global Health and Social Medicine at Harvard Medical School. So we're so pleased to now be in really 1 year into this seminar series. Our first one was like last week, a year ago. And today we'll have our fifth speaker in the series, which it's received a lot of attention and a good turnout and lots of engagement. So we're very grateful for that. Before I introduce our speaker today, let me first just offer a bit of an acknowledgement that we do at Harvard University. In my role as faculty director of the Harvard University Native American Program, I do try to bridge and reach out and engage in relations with the regional tribes here in New England. And so as part of that collaborative endeavor, we offer an acknowledgement of land and people based on our consultations with the Massachusetts tribe at Ponkapog here in the Commonwealth. So Harvard University is located on the traditional and ancestral land of the Massachusetts, the original inhabitants of what is now known as Boston and Cambridge. We pay respect to the people of the Massachusetts tribe, past and present, and honor the land itself, which remains sacred to the Massachusetts people. Today, I'm so pleased to welcome to speak with us Dr. David Wilson. Dr. David R. Wilson was appointed the first director of the Tribal Health Research Office, or THRO, at the U.S. National Institutes of Health, NIH, in 2017. Under his steadfast leadership, THRO has become the central NIH hub for addressing American Indian and Alaska Native health concerns and ensuring meaningful input from tribal leaders across the country. Dr. Wilson collaborates with partners from NIH's 27 institutes, centers, and offices to leverage agency-wide resources and realize the goals outlined in the NIH Strategic Plan for Tribal Health Research, including new biomedical research training opportunities for American Indian and Alaska Native communities. Previously, Dr. Wilson served as the Public Health Advisor and American Indian Alaska Native Policy Lead with the Office of Minority Health at the U.S. Department of Health and Human Services, and he was a Senior Research Scientist at the National Institute on Aging at NIH. Dr. Wilson also teaches at the Center for American Indian Health at Johns Hopkins University and has a PhD in molecular and cellular biology from Arizona State University. Today, Dr. Wilson is going to be talking to us about NIH Tribal Health Research Office, a holistic approach to improving health research, health through biomedical research. Dave, I'm going to turn the floor over to you. Please take it away.
Thank you so much, Dr. Gahn, and it's a pleasure to be here. And Scott, really appreciate the very warm welcome. It's an absolute pleasure. I wish it was in person, but we'll make do for now. In anticipation that bigger and better things are on our way. So I'm going to share my screen now. And I'd like to start off the presentation here, giving a little bit of an overview about our office. And I'll go more into details later on in my presentation. So here you can see this image. This was the first image of a dream catcher that we first designed when the office was stood up in 2017. And what you can see here is that in the middle of the dream catcher is our office, the Tribal Health Research Office. And surrounding it are all the beads that have the institutes and centers and offices names on them. And this is very much how we depict our role at the NIH as a major coordinating office across the NIH, and we really have a concerted effort and focus on research careers, programs, the different policies that impact tribal communities, and are all in alignment with improving health through health research. So first I did see, and I really appreciate international viewers taking the time to sit in and view this presentation. So I really want to give everyone some background on the NIH here. The NIH is the world's largest funder of biomedical research, and our mission is, right, as you can see here, is to seek fundamental knowledge about the nature and the behavior of living systems. And I think Dr. Goen can attest that this is what tribal communities have done for centuries. We know a lot about how nature works, and this is how a lot of our traditional medicines or our traditional ways were designed and developed over the centuries. So I want everybody to think about that as we talk about the NIH research and science. How would traditional ways or traditional medicine be applied onto this kind of concept or this kind of framework? And we'll get into a little more of that as the talk continues. But you see here that we're really about understanding how we work, how we function, and it's all to enhance health. You know, we really want to improve the quality of life from everybody that participates and is able to receive the benefits of the findings from biomedical research. So a little more about where we're positioned. This is an overall structure of the Department of Health and Human Services. And as Dr. Goen had mentioned earlier, that I actually was in the office of the secretary before, and then I actually did a short stint at the Indian Health Service. But these are all operating divisions that are underneath the office of the secretary. And these are really important because we do a lot of collaborative efforts with all of these different operating divisions. I'm sure that everybody has heard a lot about CDC and about CMS and FDA because of the current COVID-19 pandemic. And we've been working in close collaboration with these other operating divisions to help tribal communities address the impact of COVID-19 for their communities. Also, we've worked closely with SAMHSA, which is very focused on mental health services, and also with HRSA, you know, how our healthcare services delivered and provided to tribal members. So this just gives you an overall sense that the federal system is a really big system. There's a lot of different moving parts into it, and we are just one of those blocks there as the NIH, and our primary focus is on biomedical research. A little more about how the agency is set up. So here you can see we have two big parts of the agency. We have an intramural side and an extramural side. And I think many people out there are very familiar with the extramural part of this. And that's that the NIH funds about 80% of our total budget goes to extramural funding. So Dr. Goen and others, world leading scientists, apply for funding, receive funding, and you can see here we receive more than 50,000 competitive grants annually. The intramural side of our agency is much smaller. The world's largest research clinical center is located in Bethesda, Maryland, and this is where we do a lot of research on very devastating disease and different types of conditions. But we have a much smaller workforce than the extramural community. We have about 6,000 scientists. You can see that a much smaller percentage of our overall budget is applied towards the intramural research community. And last year, our total operating budget was around $43 billion for research. So you can see that there's a lot of research that happens. And our research actually is funded all over the world. So it's not just restricted to the United States. And that's something important to consider. So some of the things that the NIH really considers when supporting biomedical research are, number one, what are the emerging or the current public health needs? And I think we all can attest to that COVID-19 was one of those that really came up very quickly. The entire agency's focus was on developing vaccines and therapeutics that were geared towards helping our country and helping the world overcome the pandemic. Also scientific opportunities. And also, we also try to identify gaps in areas where the NIH currently hasn't funded research. And I'll talk more about how our office is really designing tools and work products that would help not only the NIH, but also tribal communities better understand what the investment looks like in terms of tribal health research. And that would help tribal leaders to be able to identify if there is an emerging or an immediate need around biomedical research, that they can then come to us, and then we can make appropriate connections for research to take place in those communities with those tribal leaders as equal partners. So now I'm going to shift from more of the agency background and structure to talking more about tribal nations and some of the considerations that we really need to think about when working with sovereign nations. So the first thing that I think is most important, and it should probably be the first bullet, but here it looks like it's the fourth bullet, is that the relationship that the tribal nations have with the federal government, it's political and it's legal. It's not an ethnic or a race-based category. It's very different. We're very unique in terms of our relationship. And this is a government to government relationship. That's also something that's absolutely critical to think about when thinking about research and thinking about how we engage tribes. Something else that I think is very shocking to a lot of the research community members that we engage with is they are surprised to hear that there are 574 federally recognized tribes out across the country with a tremendous amount of diversity. A lot of tribes have their own governmental structures, definitely their own history, unique languages and cultures. And these are all things that are really important that need to be considered when thinking about engaging tribes in research and biomedical research. So this is one of the really important things. And now here's a map that kind of gives you a better sense of kind of how tribes are dispersed across the country. And I think many people are really surprised to see that there are 231 Alaskan villages in Alaska, which is a bulk of the 574 federally recognized tribes across the country. There is a huge concentration of tribal communities in California. And our goal is that we work with all of these tribal communities. So you can see there's a lot of variability, region-specific needs. So it's really important to think about this as we talk about bringing tribes into conversation around biomedical research. Oh, and I also wanted to bring up too, if you're ever having a conversation with tribal members, it's sometimes challenging to talk about regions or identify locations on the map for communities. But if you refer to these specific IHS service areas, many of the tribes that you have conversations with will readily recognize that if you talk about the Albuquerque area, you're talking about the state of New Mexico and Colorado. If you're talking about the Phoenix area, you're talking about Nevada, Utah, and Arizona. So it helps provide a lot of context when speaking with tribal members about different research projects. So that's, I think, something worth thinking about or remembering in the future. So as we know that the country has really been through a tremendous amount of change, and we've seen this change happen in 2020, and it has carried forward and is continuing to this day. And some of the things that are really important to recognize and what we've been really exploring at the NIH is how do we address the inequalities to access to improving health care or to overall health, not only for tribal communities, but for all communities. And a lot of this was generated by the social movements that we've seen early on. The issues that happened with the George Floyd killing and a lot of the other social justice issues that you've been seeing come up on the news day in and day out. Something that's been really exciting for us is the amount of attention that the current administration has really put on strengthening its relationships with tribal communities. And you can see here the NIH actually has its own effort that's ongoing. It's called the Unite effort. And what we're really trying to address is how do we break those barriers that have led, the structural barriers due to racism that have led to underrepresented communities not being able to take full advantage of biomedical research. And so there's a lot to talk about in this area, and there's a lot of really positive change happening at the NIH. So something else that we're seeing is not only the societal shift in a lot of things that are happening, but also there's the shift in the highest court of the lands here. You can, many of you are probably very familiar with this court decision, McGirt versus Oklahoma. What is really significant about this is that the Supreme Court recognized and continues to recognize to this day that over 40% of the state of Oklahoma belongs to sovereign nations. And there are rights and there are limitations to how far the state and the government can extend into these sovereign nations. So this is something that was really fundamental in this decision. And another part of the changing landscape of how we are engaging tribes in biomedical research. So here's a little more detail I had mentioned earlier about the administration's focus on improving relationships with tribes. And in early January of 2021, this executive order came out around increasing our engagement, respectful engagement with tribes, recognizing sovereignty, but having that true partnership with them and whatever the agencies are involved in. So this doesn't just apply to the NIH, this applies to all of the federal government. And so it has been really great to see the number of consultations really increase, having that nation to nation conversation with communities around a lot of the issues that have plagued them for a long time, for decades. And now we're hoping that they're beginning to be addressed by this relationship, this new engagement that the administration is really pushing forward. So a little more, let's shift back to our office, the NIH Tribal Health Research Office. And you can see here that we were established in 2015. I was appointed in 2017 as the first director in that. So we've really, I think, made some significant strides in terms of how we include tribal communities in biomedical research. And we'll talk a lot of, and I'll provide a lot of examples here in a little bit, but I wanted to kind of highlight again, that we serve as that central hub for not only all the institute centers and offices to come to us whenever they have questions about how to respectfully and ethically engage tribal communities, but also for the tribal communities if they have questions about the research process, if they're looking for some kind of research outcomes, that they can come to us and we can help identify and locate that data that might be helpful in designing interventions for their community members. Something else that is really transformational that I'll talk about a little bit later is that our office originally designed an NIH guidance. So the Health and Human Services had originally developed a broad blanket tribal consultation policy. And our office was in charge of making sure that we adhere to that broad blanket policy. But our NIH Tribal Advisory Committee, which is a collection of tribal leaders that have been appointed by their nations to sit on our committee to help advise and guide the NIH's research investment in tribal communities, they said, Dave, we really need to have a more specific policy that is really focused more on biomedical research. So over the past couple of years, this is something that we've really been working on, is developing this policy, which I will go over in just a little bit. But the policy is being put in place to really be able for tribal communities to have more meaningful input in here, as you see here, the policies, the programs, and the priorities that impact tribal communities in terms of biomedical research. So early on, when we first began to set up the office, we really needed to provide some direction. And here you can see, this is the actual cover of the document on the screen, the first NIH Strategic Plan for Tribal Health Research. And what that entails here, you can see here, there are 4 big pillars, and how we received or how we came up with each of these strategic goals was actually through tribal consultation. So we went across the entire country, including Alaska, and we had conversations with as many tribal communities as we could and asked them, what are the specific things that you really think that are important for your community that the NIH should be thinking about. And so these are the resulting 4 strategic goals here. Enhancing communication and collaboration, which is absolutely critical. Building research capacity in tribal communities, but not only building research capacity, but expanding research. So not just having one type of discipline in different communities, but having a multitude of research disciplines in each community is what we're thinking about when we talk about expanding research. But I think most importantly, what we really want to do to make all of this extremely impactful is that we have to enhance our cultural awareness, and we have to increase our community engagement for all of these, the first 3 strategic goals to really be as impactful as possible. So this was great because this is an NIH-wide strategic plan. It's not just specific to our office. And so the agency has been doing a tremendous amount of work in this area that we'll highlight just a little bit later as well. So let's talk about, I thought there's so much to cover, but I wanted to talk about some of the specific goals and some of the things that we've done that we consider meeting some of those goals of the strategic plan. To help tribal communities overcome the pandemic and really think about how to protect their tribal community members, we had to really ramp up our level of communications with tribal communities. And this was terrific because we had reached out to our NIH Tribal Advisory Council and asked them, we need you to serve as our liaisons into the specific IHS service areas that you represent to help us engage tribal communities if they want to have more information about how vaccines are being developed, what are some of the therapeutics that are being designed, and if they are interested in participating in some of these clinical trials, to please reach out to us to come to the Throw office and we can help make those connections. So we received a lot of really positive feedback. A lot of communities were interested to learn a lot more about what this process looked like, and they really wanted to hear answers around some of the misinformation that was being spread throughout many different communities. They had concerns about the vaccines being developed too quickly. They had concerns about if you took the vaccine, if you could possibly come down with COVID-19. So we went through and clearly delineated, all the different steps, talked about how each of the different mechanisms of the vaccines worked. And it was great to see the level of sophistication that the tribes have, that they really wanted to get down into the molecular and cellular levels of how these vaccines really work, how mRNA vaccines worked, and it was fantastic. And after these conversations, there were some tribes that said, we really want to be involved in a phase 3 clinical trial. And then there were others that said, we're interested, but we would like more information. One of the examples that I really like to share, and I really encourage researchers who are listening to this presentation, think about this, is that when I went to one of my first tribal council meetings, I talked about the vaccines that were in development and what were soon to come, and the mechanisms. And some of the tribal leaders, they really have a unique and a very holistic perspective of how the US government has been treating tribal communities. And basically they took it out on me and they kicked me out of the tribal council. But after engaging more tribal councils, they actually invited me back. And when they invited me back, they said, now that we've got that off of our chest, we really want to learn more and work with you on how we can protect our tribal members. So just remember that, that there's a lot of history related to how tribes have been treated by the US government that we have to think about and take into consideration when we engage in research, not only as a research scientist, but also as a federal employee. So it's really important to think about those when engaging tribal communities. So another level here was to really engage people at the highest levels to have conversations with our tribal community. So you see here, Dr. Fauci and I had a conversation from all the things that we've been hearing from tribal communities. And so he was able to answer those. But not only that, is that he took the time to be on tribal news radio outlets on weekends, on on Sundays, Saturdays. I mean, we did a lot of whenever the tribal communities wanted to have that trusted voice talk about what we knew at the current date and stage of the pandemic that we were going to share with the communities. And so this really helped. The tribal elders really appreciated and trusted Dr. Fauci and his wisdom and knowledge of what was happening with the coronavirus. So some of the other things that we've been doing in terms of communication is trying to find innovative ways to inform tribal members about what the NIH does. So here you can see we had an interview, and these are very short, and these are on our website. So if you really want to see these, I think they would be beneficial to you. But I had a conversation with Dr. Josh Gordon, who's the director of the National Institute of Mental Health. And we talked about now we're in a pandemic, but what do you see that is basically considered a tsunami of mental health issues that are on the horizon that a lot of our tribal communities really need to be thinking about? And so we had a really nice discussion. There's a lot of resources that are available through the NIMH, the National Institute of Mental Health. And we really want our tribal communities to access this information. There's so much information, but sometimes it's really hard to get to. And also, we're working with our institute centers and offices to develop materials that are easier to understand so that you don't have to have a PhD in molecular and cellular biology to be able to understand what are the benefits and why it's so important to receive regular testing and to receive your regular checkups, even in the course of a pandemic. Most recently, we had a conversation with Dr. Nora Volkow, who's the director of the National Institute on Drug Abuse. And again, this is talking about what are some of the issues that not only tribal communities are seeing, but also the country as a whole. Fentanyl has become a tremendous issue in all of our country and all of our communities. So it's really important to think about what are the interventions available and how should people be perceiving these conditions. You know, addiction is a chronic disease. It is not a character fault or flaw in an individual. And that's what something that Dr. Volkow really is adamant about. And it's really important for our community members to realize this as well. So I'm hoping that you have an opportunity to go to the website to see some of these. And we're getting ready to do another one. The next one will be with the National Institute of Arthritis and Musculoskeletal Diseases. Many of our tribal members suffer from arthritis and other chronic diseases. So I want to get that conversation going as well. I will try to use a different picture in that posting, I promise. But these are some of the ways that we're really trying to educate tribal communities and provide easy resources so that, you know, people can, our community members can go to these and see what's available out there. So some of the really big capacity building efforts that we did were not only happened on the inside of the agency, but also translated to the outside. So the NIH had never really done a comprehensive analysis of what was being funded in terms of biomedical research in tribal communities. And so we did, here you can see the very first American Indian Alaska Native research portfolio analysis. So this kind of gave us a really good idea, you know, it really gave us a good idea of where the NIH was putting money. And we really got to see, is this the most effective way to do this? And are there areas where we can shift funding to better address community needs? So most recent, we put out the 2018 research portfolio analysis. And you can see there that there's a very detailed analysis of some of the larger umbrella programs like the NARCH program, and the ARENA program. The NARCH program stands for the Native American Research Centers for Health. It's a very unique and very popular program with tribal communities because the funding that comes from the NARCH program go directly to tribal communities. And tribal communities are then able to determine which, if any, research partners they want to bring in to help them answer some huge community health issues or problems. So that's a really terrific program that a lot of communities participate in. And our goals are to see where the funding comes from. Are there ICs that haven't really contributed to these programs, you know, that we could help them find ways to do this? So yeah, this has been one of the best internal ways for the NIH to realize how its investment is laid out and are there areas to improve. It has also helped tribal communities see if there is resources or if research has been funded in their communities that is what they need. You know, our mental health research studies are being conducted in, for example, in the Great Plains. And if so, how much? And is there a need to increase that amount? So all that information has been really helpful for our community members to assess where they're at. So I had mentioned earlier about our consultation policy, and I wanted to revisit this because this is a huge capacity building policy. And this policy is so important because it emphasizes and it standardizes an approach for the NIH, which is a huge agency. Remember, I had mentioned $43 billion budget that goes to research, and a lot of that research is conducted extramurally. So how does the agency engage tribes? And how do we request their input on how programs are developed, how policies are written, and how initiatives are formed or identified? And this is all in efforts to strengthen our nation-to-nation relationship. And again, this is really to focus on biomedical research specific issues and areas. And this was developed with extensive input from the tribal leaders and all the delegates that sit on our NIH Tribal Advisory Committee and our Office of Science Policy. And you can see here that we have really begun to get some wonderful practice on refining our consultation process. And the overall goal, again, is to, if a community in Alaska conducts a consultation with the NIH or requests consultation with the NIH, they know exactly what's going to come of that. And they know at the end of consultation, there will be a report that will outline all of the things that were heard, but also the comments or the recommendations that were received during consultation, how they were implemented into the design or the policy that was up for consultation. And if it wasn't taken into consideration, they also want to see why was that not considered in the development of this. So they're just, it's all about more clear and transparent engagement and communication with the communities. You can see here that all of these different consultations that we've had in the past have been of high priority to the communities. So a lot of tribal communities are very interested. If we participate in biomedical research, what does the intellectual property process look like? You know, are we able to receive any benefit from our participation? And these are things that we have to lay out. A lot of the IP laws are in statute, but we can talk about the process and when should tribes be engaged in these conversations. Something that was really emerging in 2018, and we had a consultation with, and this was the very first tri-operating consultation with the NIH, IHS, and CDC on the opioid crisis in Indian country. And this was really effective in helping us identify what were the needs in terms of community in developing programs that could help communities overcome the opioid crisis across the country in tribal communities. Something that's been happening as of late. So last year, you can see we were also very busy, that the NIH program underwent its first major evaluation. So the program had been in existence for 10 years, and they hadn't had an extensive review. So they had a review, but then the review comments that came back, they wanted to get tribal input on what are some of the ways that they can help improve the program. And so there's going to be a lot of really wonderful things that are going to be added to the NIH program that are going to really help tribes benefit in terms of their ability to write successful applications, but also how to execute these programs once they get the funding in place. And then also, how do you measure the impact in your communities? So we're really excited about how that went. NIGMS, which is the National Institute on General Medical Sciences, was a terrific partner with us in this consultation. And something else that recently happened this year was conversations around, and this is very new, a consultation on the RADx up, or the RADx initiative, which is the rapid acceleration of diagnostics. This was a program to help the country overcome COVID-19. There was a lot of biotech that was developed very quickly. There was a component of this called the RADx Up, which is the underserved populations component, where community engagement strategies were shared on how to get information into the communities to help them overcome COVID-19. All of these were in the form of research efforts. And now that so much research has been accumulated, data has been accumulated, it was really important for us to find ways that tribes would want to access the data and also share the data with partners. And so this is a unique step. This is something that the NIH hasn't done before. And I must say that these are very new and innovative ideas, and we understand that the first time around they may not work, but we really want to extend these opportunities to tribal communities to really begin thinking about how would they manage their own data. You know, there's a lot of conversation around data sovereignty, and this is one of the ways that we really want to respect that issue. Something else that's going to be happening this Friday actually is another large-scale COVID-19 program, which is the National COVID-19 Cohort Collaborative. So if you're available, you can reach out to me and I can send you the information on this consultation where you can listen in and hear how a consultation proceeds. Some of the other ways that are critically important is how do we develop the next generation of biomedical researchers? And this is a big part of that capacity building piece, is that there are so few American Indian and Alaska Native researchers, and we really need to identify strategies and ways to retain and build cohorts and communities. I think what Dr. Goen has here at Harvard is really important, and it's really powerful, so that students who are going to go down this very difficult and challenging road have colleagues and have peers that they can lean to say, I'm having issues in this, or how did you deal with that? And they can share and they can support each other, you know, in a cohort way to help them get through this rigorous training process so that they can go back and be biomedical research scientists in their own communities. We do a lot in terms of not only the bench science, but you can see here in the lower left-hand corner, we take the students to Capitol Hill and have them meet members of Congress, American Indian Congress. You can see Representative Davids here in the lower panel, and have conversations with them about what are some of their research priorities, or what are some of the things that they're interested in pursuing to help improve health in their communities. So very successful. This is definitely a focus area for our office in the upcoming years, and we're expanding this in many different ways. So another way that we've really been working is, again, working with the Office of Science Policy to develop policies that encourage data sharing and data management. And so these are some of the things that are so important to tribal communities. Because of some of the unethical research that has happened in the past, then all the tribal communities are aware of. You know, even though we are 574 and growing, that there's a lot of conversation amongst tribes about some of the things that have gone on, and they want to protect their communities from experiencing some of the same things. And so now the agency, the NIH Thorough Office, are really focused on, you know, how do we shape policies, and how do we put in parameters or policies that help protect tribes, but also encourage their participation in research. So the goal 4 is expanding research. This is a really big one. Some of the really new innovative things that we've been trying to do, and something that is really new to the NIH, is having community listening sessions. You know, in the past, a lot of the research that has come to the NIH has been investigator initiated, meaning that somebody who is at an institution has a great idea, they have a strategy on how they want to help a community overcome a condition or an issue, and they write a proposal and they send that to the NIH. Well, this is a different approach where we've had community listening sessions. So we want to hear from the community members that are not necessarily scientists. What are some of the issues that they see? And then kind of going in a little bit of a sideways motion, and then engaging some of the research community members to help build collaborations to do this in a more holistic approach. This is where you're going to hear a lot more of the holistic approach kind of things that we've been doing at the agency. So it's not just the communities would be the recipients or the participants in this study. They would also help design the interventions that are tested in the communities. So that's something that we're really excited about. There's going to be a funding announcement that will come out in 2023 that will be specifically focused around this effort. But some of the other things that we're doing is, you can see here, this is about the funding announcement. Another thing that we've been doing is developing training programs in collaboration with the tribal colleges and universities. And our ultimate goal is to build capacity. So we want to be able to work with the TCUs to develop training curriculum around data science, so that we are encouraging AIN students to become data scientists, so that they can go back to their communities and work in their tribal health departments, in the tribal epidemiology centers, to be able to help those institutions or organizations really put out timely reports to better get an assessment of how their communities are doing health-wise. And so more about it, I had talked pretty extensively about the RADx of the Tribal Data Repository. And here is some more about that strategic engagement and how we've been doing this. And again, we know that this is not, the first one probably won't be the best one, but this is a process. This is not a one and done kind of scenario. And this is the way science is heading as a whole, is that there are bigger and more big data programs that are being developed, not only at the NIH, but across the world. So it's really important for all of the research community to understand how to protect tribal communities, how to protect other communities if they want to encourage their participation in some of this research, so that stigmatizing research doesn't come out and set us even further back. So this leads us to something that I have, and Dr. Gone, I was an absolute pleasure to have him help us lead this effort. One of our main pillars in the strategic plan is enhancing cultural awareness and community engagement. And we were able to bring together the largest number of traditional healers, and we all gathered in Colorado right before the pandemic. You can see the date up there, November 20th through the 22nd of 2019. And we just had wonderful conversations about the importance of traditional healing, traditional ways of knowledge, of knowing, and how the scientific community could actually be a part of this and help synergize the healing in tribal communities. We heard a lot from tribal leaders and tribal healers that their approach is they don't want the community members to do a one or another, or one or the other kind of approach. So they want tribal communities to take advantage of traditional ways of healing, but also Western medicine and the technological advances that have come from that to help come together to help improve the overall health in all of our communities. So this was the first, we're hoping, of many. This report is also located on our website. So if you want to get an overview of the conversations that we had, it was a terrific initial engagement. There's much more conversation that needs to happen. But because of this particular event, more of the NIH research community is now thinking more holistically about how to engage tribal communities in research. It's not so much the approach anymore that we're going to help you identify a single gene that's going to be the answer to curing all of your ailments in your community. It's more about thinking about what are the nutritional issues or considerations that need to be in play when we think about improving health. How close do you live to, a factory that's putting off pollutants? What is your ability to receive access to healthcare? All of these things are in play, and all of these things have are a part of the equation for improving health. And the NIH is really beginning to think in that direction now as well. And that's something that's really important for us to all consider. Some of the ways that we've done, and this is kind of really down, I apologize that this is a very busy slide, but some of the things that we really want to do is to educate our peers across the NIH, but also the external community, to talk about what are the policies, how do the policies impact tribal participation, and how important ethics is in the consideration of tribal communities and their willingness to participate in NIH-funded research. How do some of the policies like the single IRB policy prohibit or restrict or discourage tribal communities from participating in research? And that's because the single IRB policies would designate, if there are multiple sites conducting research, there would be one site that would serve as the IRB of record. Well, tribal communities that are sovereign nations, they need to have the opportunity to review a lot of those research projects. So single IRB necessarily wouldn't be in play here. And it's important for us as an agency to recognize that and to understand that. So there's a lot of areas where we've been educating inside and outside of the agency around this really important topic. Something else that's really on the horizon that has been a huge consideration is how do we ethically include urban Indian populations in biomedical research? They are seen as one of the most vulnerable or susceptible or at-risk populations for unethical research. And so we really want to find ways to be able to include them and have them benefit from the research that is funded at the NIH. As you can see here, a majority of our tribal members live outside of tribal lands or off tribal lands, 7 out of 10, and that number is growing. So it's really important for us to have this guidance in place to be able to include these individuals, these folks, and that would include me, living in Bethesda. Another way that we really want to engage our scientific community is through commentary and through publications, recognizing a lot of different issues that have come out. We've had a conversation, or we had a publication on the implications of the DNA ancestry commercialization that was really popular a couple of years ago. So if you go to our website, you'll see a lot of resources here. We also have one in the middle that's really important for all of you academics out there to think about taking a look at, and it's around critical considerations for reviewing research applications. What are some of the things that I should be thinking about if I am invited to serve on a study section to recognize the importance of tribal research in tribal communities? And this document will really give you some really good fundamentals on providing as an expert reviewer for the communities. So something else that we really take pride in is bringing in speakers. So the year before last, we had Dr. Goen, who was he gave a terrific presentation, which is still recorded. You can find that on our website. Last year, we had Dr. Donald Warren, who is from the University of North Dakota, and he talked about the interconnectedness between culture and science. So again, more education, but it's from a different perspective, and it really adds to that base of how we engage tribal communities. So this is I think a really good example of what I wanted to show in terms of how the Thoreau office and the NIH really took a holistic approach to engaging tribal communities in response to the pandemic. And so the Thoreau office was invited to participate in the Coronavirus Prevention Network. And it was a collection of long-standing organizations that had conducted HIV research in communities for a long time. So they really understood the sensitivities that go into approaching communities that had been stigmatized in the past around the emerging pandemic. We worked in collaboration with all of the different federal operating divisions. But what's very unique to this is that in these boxes, you can see here expert panels. Well, the expert panels were members of the community that came in and were able to review research protocols, the clinical trial protocols from each of the different pharmaceutical companies that were looking to take their vaccine products to the phase 3 trials. That we had the opportunity, the community members had the opportunity to review these, read these, and say, these aren't clear to us, or we're not sure what you're actually saying in these. Provided excellent feedback to the pharmaceutical companies, which then they revised protocols and then they were able to put those out. They also helped the companies develop communication materials to help address a lot of misinformation or inaccuracies that were being spread at the time. But you can see here that tribal nations are here. They were included in all of the conversations that we had whenever they requested conversations. But our ultimate goal in this was not to increase the number of American Indians and Alaska Natives participating in clinical trials, but it was merely to give the nations the opportunity to make that decision and to exercise their sovereignty. So there were communities that said, you know what, we're not ready for this yet. There were others that said, we are absolutely ready, and we facilitated their participation. And we're hoping that a lot of the work that we did was communicated in some way, at least in some part, around American Indian and Alaska Native communities having the highest rates of vaccine uptake of all members of the US. So there was extensive engagement and knowledge, but it was very much in a holistic way. We engaged traditional healers, trusted members of the communities, so they all really played a role in helping relay information related to these clinical trials. So in the interest of time, I want to quickly just go over some of our highlights. But why all of this was so important, this is really what I want you to see here, is that when I started in 2017, the investment for the agency was around 180 million. And as of the projected investment for the agency in 2022 is going to be around 355 million. That is a significant increase. And I think that this is all in part to engagement and involvement with tribal communities, having that standardized approach of how to ethically and appropriately engage tribal communities in consultation, in conversation, to help develop some of these programs. I think all of this in a very holistic approach has really helped increase the amount of resources, but also increase the overall impact that biomedical research is going to have in tribal communities, not only now, but in the future. So for those of you who are in different institutions across the country, I think it's worthwhile to do some self-reflection and think about, what does your portfolio look like? What does your agency's portfolio or your institution's portfolio look like? Do you have policies in place to engage tribal communities ethically and appropriately? And are you training the next generation of American Indian and Alaska Native scientists? And just always remember that our office is here to help. If you have any questions or you need something in terms of the research process, we would be happy to help. And something that also is really important that we always take home and always consider is that everything that we're doing today is going to impact the next 7 generations. And so our ultimate goal is to really start that domino effect so that health will really be able to improve not only in the next 7 generations, but in every generation moving forward. So with that, I want to say thank you so much for your time. There was so much to cover, so much to talk about. But I hope that this was worthwhile. Please go to our LinkedIn site. There's a lot of training opportunities that we're posting all the time in our website. And if you want to reach out to me, there's my email. You can contact me directly. I will stop there. Dr. Goen, I will hand it back to you. Thank you, sir.
Well, thank you, Dave. This is just fantastic, a real whirlwind overview of some very important initiatives and, of course, an incredibly increasing amount of funding going to very important projects. So it's exciting to learn all that you're doing there and the important role that your office and your leadership has played in all of that. So thanks for all that you're doing for Indian country. And for being willing to come talk to us today and share with our audience, which, as I said before, includes a lot of folks who are not just researchers, but community members who are interested in attracting research. And so, yeah, I know you just put up a slide, but I wanted to read one comment that I received just because I want you to have a chance to speak to it just again. Helen Rousset writes, my community's tribal college, Stonechild College, is very interested in expanding community-led research capacity. This is all very helpful information, whether it be links and recommended steps to leverage the support from NIH Throw or NARCH to move our work forward. I think other people like Helen are probably just wondering, like, how do you even just get connected, or where should they start? Because there's so much information, a lot of links, a lot of publications. What should they do if they just want to figure out the lay of the land a little bit?
Yeah, that's a absolutely terrific question. What I would recommend is you just reach out to us, and please, let's start that conversation. This is how it all begins, and coming into the NIH, people don't realize that this throw office not only engages the federal side of it, but we are also in all of the academic institutions and in all tribal communities. So if there's questions, we would be happy to lay out a strategy for you, to help you identify. We work closely with AHEC. We work closely with a lot of the TCUs. So yeah, please reach out to us and we can begin that conversation, because like I said, it's not a one size fits all. So I'm not going to refer you to a website or an application and say, fill this out, because it's so different that each of our communities need things so differently. And so, and the priorities are very different. So thanks for the question.
Terrific. Thanks for that. And of course, NIH is the federal portfolio for health research. You didn't say in your question, Helen, whether it was only health research you're interested in. It's worth noting that the National Science Foundation also has a tribal college and university program, the TCUP as they refer to it. So that might be another way, depending on the kind of research you're talking about as well. But obviously, NIH is very important for the health needs that we need more information about. Well, Dave, one thing that I think would be great to unpack a little more for the audience is this process of tribal consultation. You talked about the Tribal Advisory Committee, or the TAC, and how there's the government to government relation that's observed through your convening and coordinating and listening to these folks. Can you just tell us a little more, like how many of those folks are there? How are they selected? What do they do? Or what does consultation look like? Like, give us a peek behind the curtain as to what tribal consultation unfolds like.
Yes, thank you so much. So the NIH TAC, they serve as advisors for the agency's investment. So they hear about the different big programs that are coming down the road for the agency, and they help us either redirect or modify those programs to have greater impact in the communities. But if they feel like this is something that really needs to have more tribal input, then they recommend, or they would advise us to take it to consultation. And consultation is an enhanced form of communication, where the highest levels of federal government meet with the tribal leaders of sovereign nations. And so we're able to present to them our ideas around specific programs, and then ask for their input about what it would take, or what are some of the changes that need to be made that would encourage their participation or their community's ability to engage in these particular research efforts. And so that's the overall goals for consultation. And it's really a government to government engagement. And again, it's an enhanced form of communication, where we hear about what are the community needs, but also what are some of the things that we need to be changing or shifting to meet those community needs respectfully.
And you just mentioned the emphasis on the government to government relationship and how these are representatives from sovereign tribal nations. One question I'm getting more recently, I think in the wake probably of the census figures that show a pretty dramatic increase in Americans who identify as American Indian, Alaska Native, Indigenous in some way, shape, or form. Every decennial census period, we find more people identifying than birth rates could possibly account for, which means that there are people who are identifying as Indigenous who didn't identify as Indigenous before. Some examples would be a lot of Latin American immigrants who maybe in decades past might have marked their race as white, but more increasingly might say American Indian. So I know that there's the importance that you're accenting on tribal consultation and government to governmentality. At the same time that there are lots of people who identify as Indigenous in the United States with serious health concerns. I think people often talk about like migrant workers who are from Mexico perhaps, and who are tribally identified there, but who fall outside of this federal relationship and the sovereign nations within the United States. What prospects or potential is there for health research funding for grants and projects that work with other Indigenous identified folks outside of the formal tribal recognition?
Yes, another great question. So this is something that is a new development at the NIH, is that we've begun working more with the Fogarty International Center, and they are the entity at the NIH that provides funding to communities across the world, across the globe. And they are now really thinking about how to engage other communities, and so terminology means a lot here. And so part of our goals in the NIH at the Thoreau office is to help streamline some of that terminology. And this is an FDA term as well that we had challenges with, is that when we use the term indigenous, it means all the communities across the globe. But when we use American Indian and Alaska Native, that is very specific for the federally recognized communities. So Fogarty International does a lot of funding for indigenous communities, which includes those that are outside the US. So we have to be very careful whenever because it creates confusion. So there are a lot of different efforts, and we've been meeting with the Canadian Institutes of Health. It's the analog of the NIH, but in Canada, and talking about their research portfolio and trying to identify ways. They've been very interested in our consultation process, and so we've shared that with them. So there's a lot of, I think, conversations going back and forth about how do we share best practices to improve not only the American Indian and Alaska Native communities in the US, but also indigenous communities outside the US.
Very illuminating, thank you. And one other thing I think about the government to government relationship and the Tribal Advisory Committee, for example, you end up in that context often having a dialogue between federal representatives who are often kind of in listening mode and trying to figure out how best to meet the needs or accommodate the interests of tribal reps, and elected tribal officials or their designates who by and large are not trained in research and are not researchers themselves. Often what I find is that there are not researchers at that table, especially like indigenous researchers who are tribal members themselves, for example. And I do wonder sometimes if there's not something lost in the dialogue when it's two-way instead of potentially three-way. And I have a team of folks I'm very pleased to be working with right now, all indigenous researchers in health, who have been pointing this out. Like, isn't it interesting or odd that like we're never invited to this table? And it's not that we want to throw our weight around, but it's just that we want to serve our communities too, and we have a particular set of experiences and lenses to look through for these things. So I wonder if you could speak to that issue a little bit.
Yeah, absolutely. So one of the things that we do, which is a little different than a lot of the other operating divisions, tribal advisory committees, is that we also invite a technical advisor to help support our delegates. And many of these technical advisors are directors of health departments or folks who have research backgrounds. And so they are able to provide background information to help guide the decisions of the elected official as they provide formal recommendations to the agency on the research that's funded. So we are a little different. We have taken that into consideration, and it has been very, very productive and beneficial to the delegates, because like you said, many of them, they deal with so many other things. They deal with water, with transportation, with criminal justice, all these different things that are happening in a community. And research is just a small part, and that's one of the things that we sometimes have a hard time seeing. So it's important to bring in that support specialist to help them when we have these meetings.
Yeah, that's wonderful, and it helps to address some of the limitations I was discussing. Here we have a couple of questions and answers. So folks, if you have questions or answers that you want to specifically ask Dr. Wilson, please put them in the question and answer section so I can get to them. Here's a fairly straightforward one, just informational. Can you please restate what RADX stands for again?
Yes, it's the rapid acceleration of diagnostics for the COVID-19 pandemic. So that's what it stands for.
Great. And related to that, someone asked, how do you build an intercultural dialogue about COVID protocols?
So this is what we've done, and it's a great question, where we've included tribal communities. So for example, the Pascua Yaqui community, or I'm sorry, the Tohono O'odham community in Tucson, they actually went through the CDC guidelines and they adapted those guidelines to incorporate the most important things in how they conducted ceremony. So when we saw one of the waves going down, they were thinking about coming back together, but incorporating the social distancing and the mask wearing, but they put them into cultural context. And so it really helped community members adhere to them. And so they were able to participate and they were able to benefit from ceremony. So that was one of the ways that it was done, and it was different for each of the different communities. But when, this was a part again of us providing the NIH side of the research that was happening during that moment in time, and then asking the tribal leaders, the tribal health departments, to help us translate that information so it's culturally appropriate to their specific community needs.
Yeah, and I remember early on, receiving in my email a message about COVID vaccination from medicine people from some different tribes, and I just thought that was amazingly done in terms of reaching people with some authority beyond the usual biomedical authorities we hear from, which are important too. But this reaches a different sort of group. Yeah. I'm just thinking, can you put up, the kind of money that's going to different grants that are concerned with Indian health research? You talked about there not being that many Indigenous or Native or Indian health researchers themselves. Do you have any sense for what proportion of grants are going to Native identified PIs, for example, or what proportion of grants that are extramurally funded are going to Indian projects?
Yeah, that's a great question. And we really don't have the answers to that. And I think, sometimes it might come off as a little unfair, because there are institutions that have developed tremendous relationships with tribal communities that are also training the next generation of tribal community members to take on that research in the future. And so we haven't really been able to do that. And I'm not sure that we would in the future. But it's important to know that the research that was captured by our extensive data analysis, that has gone through so many iterations, because data is such a challenging thing to go through and to be consistent with, is that we know one of the things that we really tried to get out of there was that research projects that brought in one student for 6 weeks was considered a whole research project that supported AIN research when it supported one student, so it was really cleaning up that data. So we have a really good sense of the data we are presenting now is accurate, and it is benefiting tribal communities. I think what we can do and how we could get a better sense of this is through the NIH program. Now, I'm not exactly sure how many NIH grants are funded or have been funded, but that would give us a true sense, because that money does go to the tribes, and that would give you a better sense.
That NIH program might be worth unpacking a little more here, because the old school model, and probably pretty dominant model still, is you've got a principal investigator, a researcher who is at some university or some research think tank or wherever, who puts in a grant proposal that says what they want to do, and then it's evaluated, and they might get funded, and then they get money and they do the grant. And the authority is really heavily concentrated in the principal investigator, and they're evaluated on their own expertise and the ability to do the grant, et cetera. Strikes me that, at least in my experience, what tribal researchers, tribal leaders want is a much more kind of accountable, much more of a community driven and community engaged approach to research, in which the authority of the principal investigator is sort of more limited. There's a lot more goes on in terms of the engagement and the accountability. And NIH is interesting to me because, at least as I've heard the story, Dr. Cliff Poudry, who was a fruit fly researcher and a Seneca Indian biologist, put this in the budget once for NIH to fund these NIH programs, NIH, Native American Research Centers for Health. And the big innovation there is that the research grant goes to the tribe, not to a principal investigator. And it's up to the tribe to sort of pull in researchers they want to be involved on projects that they care about. And of course, it has a heavy capacity and training element. It's not the same as, an R01 grant. But I mean, what more can you tell us about NIH and the kind of ethics of engagement and accountability and the role of the PI in light of these trends?
So the most recent consultation that happened with the NIH program was an opportunity for a lot of the tribal nations, for all tribal nations, to chime in on how to improve the program. And some of the things that we heard from consultation is the need for a resource center to be established to help American Indian, Alaska Native researchers write grants that may be first timers, to do this. Also, tribal communities that have received their first grant, how do you manage, or how do you keep the reporting, in line, because you have reporting requirements for grants? How do we handle those as first-time grantees? So this resource center, which is something that was proposed, and and also something else that was brought up, were that tribal IRBs don't have the capacity right now. There's not a stable capacity, or they're not sustainable, because a lot of the tribal members who serve on tribal IRBs are volunteer. And how are we going to ever build capacity in the communities if they're trying to review grants while they're having coffee or tea during their lunch break? So it's trying to really carve out and make this a formalized process where it's more sustainable, so that more communities can go through and receive and review and approve more research projects, so that their communities will benefit at a greater extent from the research that's proposed by NIH grantees or by others. So there's with the NIH program, there's so many different things that are that we're really considering. I think the training is one of the absolute biggest parts of this that I think will have the greatest impact. How do we, there's so many different disciplines out there. Our communities have so many different issues that we're really trying to resolve. We need one person or two people can't do it all. So we need to have hundreds of AIN scientists trained to be able to help us answer these questions.
Well, such an important point, and the pathways into that are narrow and constrained in important ways. So figuring out how to widen those pathways is so important. And I know NIH has training grants and postdoc fellowships and so on that really help for us to do that. I wanted to spend just a minute or two on the Traditional Medicine Summit from November of 2019 that you talked about. And of course, I was really grateful to hear from you about that in terms of helping to organize, because it was such an important, momentous, memorable event to pull together these 35 invited guests, the majority of whom were tribal healers, medicine people, practitioners, cultural practitioners, to hear about their priorities and interests and concerns about engaging with biomedical researchers and research. I wonder if you can say a little bit, first of all, why would there be any interest at all from such providers in engaging in biomedical research?
You mean on the traditional side, or?
Yes, right, yeah.
Well, I think that it's one of the, so our healers in our communities are so knowledgeable, and they really understand their limitations. And one of the things that have been expressed to us and to our office time and time again is that our elders and our tribal healers are really concerned that the younger generations are drifting away from our upbringing, or our roots and our cultures and our ties. And the only way to really get them back is to recognize that there is a Western component of this that needs to be considered, because we can't have a one versus the other, but it's more of a synergizing both Western culture, Western science, Western medicine, along with the traditional ways of healing, traditional ways of knowledge. And having that really good balance is going to be the best combination that's going to not only bring more community members to rely more on traditional ways of healing. And the ultimate goal is to think about, some of the things that we suffer from. We have a headache and we want to run down to CVS and get, a pill to help us resolve this. Well, what are some of the cultural or some of the traditional interventions that we have practiced for centuries that we should be thinking about instead of running down to the pharmacy to do this? So we're relying on our traditional ways to not only reinforce our culture, but to also continue our languages and other really important things to help us identify who we are in the world.
I mean, related to that is even sometimes the language you use, such as even your titles, biomedical research. I know that's the NIH, a way of languaging what their commitments and priorities are. Most tribal healers and practitioners and medicine people I know, always say health is a holistic endeavor, and biomedical can be pretty reductionist. Like, what are the ways that you have to finesse, or what are other ways of languaging health in relation to biomedical frameworks that have been useful to you?
Yeah, that's a great question. So biomedical is a term now that we want to have. When you see more programs coming out from the NIH, they will include sponsorship from a multitude of institutes and centers. So when we talk about a chronic condition, you're going to see different institutes and centers partnering because they want to address different things in a very more holistic approach. So it won't be just, again, that, like you had mentioned, the Cartesian approach to solving problems, which is the reductionist way of identifying a single thing and fixing that, and then that will be the end of your problems. It's more about looking at where you live, what do you eat, what kind of water do you have access to. On the Navajo Nation where I'm from, the open uranium mines are a big environmental concern. Cancer is rising, and so these are all things that really need to be taken into consideration when thinking about biomedical research. It's not just a specific gene concept anymore. It's a more holistic approach to how we solve issues now.
Great. Yes, very, very important. Thank you. You are the first director, the inaugural director of the Tribal Health Research Office, which means that in these past years, you've had to invent the way of getting work done and responding to various constituencies in an effective manner. You're doing it very well. What have been some of the biggest challenges you face sort of administratively or intellectually or in whichever domain in terms of doing your job and being effective?
Yeah, wonderful question. That is the $10,000 question, right? So it's such a unique expertise, and it's a challenge to be able to identify individuals who really understand the nuances of working with tribal communities. So that, finding the right staff or the right team members has really been a challenge. Who has knowledge about the NIH and how all of the grant mechanisms work and all of the administrative stuff, but also understands tribal communities, and underrepresented communities. So that has been a challenge, is identifying the right staff members who could really help us move this forward. The second thing is I'm always leery of trying to recruit American Indian Alaska Native scientists to help join us to do this work, because I'm taking somebody out of the community, and that's what always is a big challenge, because there's not enough of us, but there also needs to be redundant mechanisms in place so that this important work can move on. So I think there's really a need for some type of training to help people understand not just the NIH, but the federal system as a whole. It is really a very different environment to work in. And so without that knowledge, it is really challenging, to make headway in these efforts. So we are really changing culture of an agency. And I think that one thing that you have to do is, and all of us Native Americans have this, is be resilient, right? And be patient and know that the change is coming. You just have to keep pushing and pushing and pushing.
Fabulous. Yeah. Well, I think we're winding down today. I'll just close maybe with one other question, which is, what, as you look on the horizon and you see all the work unfolding that you've been involved with and helping to facilitate and promote, what makes you most hopeful, most optimistic?
What makes me most optimistic is tribal leaders reaching out to me, one-on-one, and their interest and their curiosity around research. And I love the conversations where they say, we've heard about this biomedical research thing, but what is it? And how can it help benefit our communities? And so we have these conversations, and they said, oh, well, this is exactly what we want to do, but we want to do it on our terms. And I think that the agency and more NIH officials are really understanding what that means, working with a sovereign nation. And as we continue to do this in terms of shaping or refining policies, as new programs come out, now we have the standard way of engaging tribes through the Consultation Policy, that more tribes are going to be engaged, they're going to be involved, and this is going to help build capacity. I think right now we have a lot of tribal communities. Some of them are really good and have been working in science and research for quite a long time, so they have a significant infrastructure to support research. Well, our goal is to bring everybody up to the same level. And so that's what I'm most optimistic about, is those tribal leaders who we haven't really engaged us in the past are now asking these questions. How do we compete with you Navajos? How do we compete with you guys in terms of research? And so we're happy, we're happy to help them get to that point. So it's been really exciting in that front.
Really exciting indeed. Dr. Dave Wilson, I'm so pleased that you joined us today, gave time out of your very busy schedule to share with us the important work that you're doing and the accomplishments and blossoming of the Tribal Health Research Office to help address the inequities and the need for consultation and the accountability to tribal communities, et cetera, that biomedical research surely needs. So I'm so grateful. Thanks again for joining us. Let me just also say to folks who are still with us that the Indigenous Health and Wellbeing Colloquium Series has been meeting about twice a semester. So we're pleased to have one more event scheduled for this semester. It will happen on April 27th, when we'll hear from Dr. Alexandra Adams from Montana State University